Good morning. For those of you that don't know me, my name is Herb Klein. I'm the President and Chief Operating Officer of the United Way here in Mercer County, your United Way. On behalf of the Greater Mercer County Partnership, please allow me to collectively welcome all of our community leaders from both the public and the private sector. There are so many of you here today, we're not going to do individual introductions, but I want you to know that in no way diminishes our thanks that you've participated and decided to attend. Also, numerous agencies, there's private citizens here today, and I know you all will be very engaged by this morning's program. I also would like to thank ETS, not only for hosting, but also being supportive of this program and supportive of our community. ETS does so many things for us, not just with United Way, but all of Mercer County. Thank you very much, ETS. The Greater Mercer Public Health Partnership would not be possible if not for the vision and the commitment of the Robert Wood Johnson Foundation and their New Jersey initiative. For those of you that don't know, Robert Wood Johnson is the nation's largest philanthropy devoted entirely to public health in the United States, the largest. Their efforts, spanning 40 years, focus on improving both the health of everyone in America and healthcare, how it's delivered, how it's paid for, and how well it does for patients and their families. They're guided by a fundamental premise. They are stewards of private funds that must be used for the public interest. The philanthropy they practice seeks to be transformative, to change society and the lives of all Americans for the better. We're quite fortunate here in Mercer County to have them as our neighbor. Just as the Robert Wood Johnson Foundation, we at the United Way are committed to the public good. We're conveners of new ideas, supporters of those predisposed to action. Our focus on education, financial stability, and health aligns us with our community, and we are honored to be serving as a project lead for this important effort. I attend many events in Mercer County, and I see many of the same people. Today is different. We actually had to turn people away. Today is about the future of the community health in Mercer County, and I can tell by the standing room only and the people lined up outside that it's important to each and every one of you. Health is a very personal issue, and you're going to hear a lot about that here today. We're at a crossroads in America as we address the fundamental questions of what, when, where, who, and how healthcare should be delivered in our community. You only have to listen to the radio, evening news, pick up the newspaper. It's a story in every day on the front page. Gone are the days when community health was just about you, your doctor, and the nearest hospital. As you will hear today, neighborhoods, transportation, housing, environment, education, and income levels all play an important role in determining community health and measuring healthy communities. I have to tell you that this project has been a tremendous experience for all of us involved, beginning with the sponsorship of Robert Wood Johnson, the partnership of the United Way, local health departments and hospitals that participated, the formation of an active community advisory board that will continue on after this meeting for the next year, the community at large, numerous focus groups, interviews, and interactions. People have been energized in a number of ways, all working together to define community health in Mercer County. Many assessments have been done here before. None have been this comprehensive. Somebody's going to get their SAT scores published. As we continue our efforts beyond the assessment, you'll learn today how we are developing a blueprint for the community moving forward. And that is going to be the ultimate outcome from this assessment that you're going to hear about today. We've worked hard to be inclusive. Community health touches everyone and has a common goal to improve the quality of health and life for everyone. Every effort and every project and everyone in this room has been a part of an effort, and they all require leadership and commitment. And we at the Greater Mercer Public Health Partnership are quite fortunate to have Tony Lewis, who not only demonstrates both daily, but also inspires the same in others. And if you've ever been to any of our CAB meetings, 120 people show up at 7 o'clock at night, consistently interested in public health. It's because of the lady that's to my right. So with no further ado, it's my pleasure to introduce Tony Lewis, our project manager, who will be your master of ceremonies for the rest of the day. Thank you.
So, like Herb said, traditionally community health assessments have been done before. should have my clicker ready. Anyway, and they've been done before. They've been done by hospitals, public health departments, and the United Way. Actually, in the past, though, they've always been done independently, and simply because these organizations need to understand the people that they serve, okay? So they have to understand their needs. Well, this time it was different because we, as you can see all those organizations up there, we all work together to do this. And not only that, we included the community, as Herb said, the Community Advisory Board. These are people who represent different sectors of the community, sometimes involved in health and actually outside of health as well. Let's just say that this was one novel, monumental joint effort. Today's event is epic too, because not only do we have people in the room who represent health, public health, and social services, but we also have people in this room today who represent all the other sectors in the community, like transportation and government, education, and it goes on and on. So it's taken us a half a year to get to this point, actually half of 2012. And we are going to unveil what we learned. I hope you're excited to hear this information. It's very, very valuable. But we also hope that you'll be stimulated to stay involved in our project. That's part of why you're here. We need your support. Moving forward, this fall, we're actually going to come up with a big vision. And that vision is going to basically look at the needs that were identified, and we're going to work on them with an inclusive community-wide approach. Okay. What defines community health? Well, community health is pretty much very similar to individual health. In terms of individual health, it's billions of cells in the body that, to stay healthy, get what they need. Well, community health is, in this case, close to 400,000 people in Mercer County getting what they need. And then the question is, well, what does the community need? Well, I think everyone in this room understands what you need to be in a community. I mean, you need to have clean, safe streets, be free from discrimination, have a say in your government. You need to be able to find meaningful employment. You want your children to get good education, and it goes on and on. So here's a definition which may be hard to read, so I'll read it for you, because in short, a healthy community is where all the citizens can be assured they are getting what they need, not just to survive, but to flourish, economically, physically, environmentally, socially, and politically. I'd like to introduce you to our incredible research team presenting the data today. It's Health Resources in Action. We have Lisa and Rose from that organization, and I just want you to know that Health Resources in Action is actually a nonprofit organization, and I just wanted you to hear their vision because it's really, really great. It's a world where social conditions and equitable resources foster healthy people and healthy communities. So here from Health Resources in Action is Lisa Wolf. A little background on her is her title is the Director of Research and Evaluation. She has a doctorate from Harvard University and a master's from Stanford University. She lives in Cambridge, Mass. with her husband and 2-year-old, and she's actually originally from New Jersey. Also from Health Resources in Action, we have Rose Swenson. She's the Director of Strategic Planning and Organizational Effectiveness. She holds a master's degree in business administration from the University of Wisconsin at Madison. Rose lives in Pittsburgh with her 2 children, and she too also originated in New Jersey. Take it away, Rose and Lisa, if we can just give them a big round of applause. They did a lot of work.